Brown, PGY3 from Weiss Memorial Hospital, Chicago, Illinois. I'm going to present a clinical vignette name is Where Have All the Bicarbonate Gone with my colleague PGY1 Pervin Nejat from Weiss Memorial Hospital. Before I present my clinical vignette, I would love to dedicate this clinical presentation to the Pete Seeger, who wrote a folk song called as Where Have All the Flowers Gone during the war times in 1950s as a call for peace. Pete Seeger's lyrics show how war and suffering can be cyclical in nature. As girls pick flowers, men pick girls, men go to war and fill graves with their dead, which get covered with flowers. I would like to present introduction as it is important. Although common causes of high anion gap metabolic acidosis are well known, etiology of hyperchloremic non-anion gap metabolic acidosis due to orthotopic ileal neobladder are very under-recognized, but especially by internists and general practitioners as a cause of severe metabolic acidosis, and since this entity is not treated appropriately because of it is very rare in clinical practice. My case presentation will be the second case who is going to be reported in the literature where required admission due to ICU due to severe metabolic acidosis. Orthotopic neobladder is an internal urinary diversion in which a segment of small intestine is used to form a new neobladder reservoir for urine. Ureters are attached to the neobladder as it is urethra, allowing voiding to be done via natural course. As clinical images demonstrates, actually urinary diversions can be separated in ileal conduit, continent cutaneous reservoir, and orthotopic neobladder, which means actually creation of formation of a new bladder at the place where the previous bladder were located. Case presentation. We are going to present a 68-year-old Caucasian male with PMH as mentioned, who was initially presented to ED with chief complaint of generalized weakness, extreme lethargy, and drowsiness. On presentation, his vitals were quite unstable. Respiratory is 26, heart rate 110. He was setting 99. His physical exam was remarkable for lethargic-looking elderly male who was tachypnic moaning due to lower abdominal pain, and abdominal exam was remarkable for diffuse tenderness. His labs were remarkable for severe acidemia. Bicarb was only 2. Chloride was 123 and creatine was 6.23. The patient initially admitted to ICU due to severe hyperchloremic metabolic acidosis secondary to urosepsis and ureteroenterostomy. Patient's bicarb deficit was significantly high. He was loaded with sodium bicarbonate and started on bicarb drip. During his ICU stay, patient was noted to have urinary retention. Foley catheter was placed and he was started on broad-spectrum antibiotic for E. coli urosepsis. On the second day of ICU, despite his ABG acidemia significantly improved, his bicarb level hasn't improved much from 2 to 7. In addition to treatment with bicarbonate, the patient was commenced on chlorpromazine and nicotinic acid. Over the hospital course, his acidosis, severe AKI, and E. coli sepsis remarkably improved, and the patient was successfully safely discharged home with chlorpromazine, bicarbonate, and nicotinic acid tablets. Discussion. This rare, unique case, which is second case in the literature who required ICU admission due to metabolic complication of neobladder, this case highlights the importance of hyperchloremic severe metabolic acidosis can be life-threatening. The mechanism involves actually the ileal segments absorbing urinary electrolytes such as chloride in exchange of sodium and bicarbonate. Conventionally, it was treated with the bicarb or citrate tablets. However, results were not satisfactory. And as reference, as my second references, Koch and McDonald and his friends demonstrated in rat and canine models, chlorpromazine and nicotinic acid could be actually alternative adjuvant treatment, as they anecdotally shown benefits in the similar rat and canine models who got orthotopic neobladders. As learning points for this case, for internists, early recognition of these acid-based metabolic complications and having awareness of alternative regimens like chlorpromazine and nicotinic acid in addition to sodium bicarbonate and straight tablets would be helpful for these